I was introduced to the Wiley Protocol about 3.5 years ago by my then associate, who was a female obstetrician gynecologist, and she'd gone to the first Wiley seminar, or maybe she went to the second, but she'd gone to the seminar and came back and told me that this was something that was really profound, and it was something that I really had to learn because it would revolutionize the way I did hormone replacement in women and the way I thought about hormone replacement for all of my clients. I read her manual and I read the book Sex, Lies, and Menopause, and I realized that she was probably right and that I would have to go to the next seminar. I began to do the Wiley Protocol before the seminar under her direction because she was doing it exclusively in her practice at that time. And I would begin placing my clients on Wiley Protocol and following the instructions in the manual, which proved to be very complete and made it very easy for me to do a good job. You know, good books and good procedural manuals make you smart overnight. They give you the ability to do something that's very complicated with a great deal of proficiency and expertise right away. That's what I found in the manual, and I had more than enough to talk about with my clients about what I'd read in Sex, Lies, and Menopause. So I began using the protocol about 3.5 years ago, and now I tell women who come to me that it's the only method of hormone replacement that I'll offer them. That if they want static dosing, which means the same amount of hormone every day, or if they want anything other than bioidentical hormone. For that matter, it really doesn't matter. If they want static dosing of bioidentical hormones, then I tell them I really don't, in good conscience, I really can't do that. I don't think it's the best protocol, and I have learned from looking into the science and the technical references in the manual that it might actually be dangerous to do static dosing of hormones. The point of it is that the Wiley Protocol requires each woman to reach a peak of estrogen on day 12. That peak of estrogen sets in motion safety factors and protections that women do not get when they don't peak their estrogen on day 12. And that's why I think that it might be more dangerous to do static hormones than to do nothing at all. And I don't think that women should not do anything about menopause. I think women should take bioidentical hormone replacement. I think they should use what's now being referred to as rhythmic cycling or biomimicry, both of which are generic terms for the Wiley Protocol.